I had no idea my teeth problems were related to my menopause.
Wow. I could barely even define menopause at the start of this conversation.
Hi, everybody. So we're here to have an open conversation about menopause. And this talk is sponsored by Delta Dental to highlight their 2025 Menopause and Oral Health Report. My name's Alex, and I'm his mom.
Yeah, I'm Giancarlo. I'm Alex's son, and I'm very excited to talk about menopause.
I'm sure you are. So I'm going to ask you a few questions. Let's see how you do with this pop quiz.
Okay.
Ready? What is menopause?
Menopause? Oh no, this is already a hard question for me.
Shouldn't be.
Menopause is a stage that women go through between their 40s and 50s regarding their cycle.
Okay.
Well,
That's it?
I'm being as succinct as possible.
Okay.
I would say that I am not as aware of what menopause is precisely should be as I should be.
Alrighty. So menopause is 1 year after a woman's last period. Okay. Women actually go through perimenopause. Then 1 year after their last period is menopause. And then anything after that's just 1 day. Menopause is actually just 1 day. And then anything after that is post-menopause.
Oh, menopause is just one single day?
1 day when it's the first year birthday of the last period.
So when people say I'm on my menopause...
Well, we usually mean post-menopause.
Oh, okay. It must be a horrible day.
You know, my case is a little bit different because I had a hysterectomy when I was very young. I was able to distinguish when my periods were supposed to be, but I can't tell you exactly what day my menopause was because I hadn't had periods for years. But I could tell you the next question because I did have symptoms. So that was my next question is, how many symptoms of menopause can you name?
Okay, I think I know a couple.
Okay.
I think stress is one of them, has to be. A lack of sleep. I think your hormones are completely thrown around everywhere. Sometimes there's weight-related issues, but what I understand, there's got to be more, but I can't think of any more.
All those that you said are correct. The most, I'm going to say popular one is hot flashes. Anytime anybody thinks about a woman in menopause, they think of her having a hot flash or night sweats. The weight gain, obviously, woohoo. That's not a fun one. Allergies, digestive issues, headaches.
So all the worst possible things that can happen to a human being are just in the series.
Like, I think, childbirth wasn't enough.
Yeah.
And nature said, let's just throw in a little extra stuff.
Let's just throw everything at these people.
The girls.
Oh, wow.
All right. And there's some oral health symptoms like dry mouth, tooth sensitivities, even changes in your gums.
Oh, I had
more cavities.
I had no idea that it affected the mouth in any way.
Your hormone levels go down a lot. And so a lot of your organs are affected. It affects your bones, so it can make your jaw weaker and your teeth weaker. My teeth were literally moving and they were so weak. So I did have some oral treatment where they strengthened my teeth and they gotten much better.
Did you know that it was going to affect your oral health?
You know what? The symptoms I was having, I didn't know they were related to menopause, but thankfully my dentist did. And she said, this also has to do with your hormonal issues right now. So let's work on it like this. She made a plan for me.
Oh, that's a good dentist.
So she was the one that made me aware that the things I was experiencing could be because of my hormonal health.
Right.
So now, do you know what burning mouth syndrome is?
No. I hope I never find out.
Okay, so it's a symptom or a condition that causes persistent burning sensation in the mouth, often affecting the tongue, lips, gums, but there's not a visible sign of damage.
Okay.
It just you feel like they're really...
It feels like your mouth is on fire?
Yeah, like your mouth's on fire.
Do most women know about these symptoms when it comes to menopause?
For my mom's generation, the generation before us, they just kind of sucked it up. Even historically, people would think they were going crazy. I'm talking about the Greeks and the Romans.
Right.
They thought women were going crazy because of all the symptoms. And historically, it's not a topic that's been talked about too much. I remember when your sister first got her period, and I sat you and your brother down and I said, listen, there's always going to be a woman in your life. And you better understand what happens and how she feels so that you can know how to treat her and best help her deal with her periods. And because it sucks sometimes.
I remember you told us,
okay?
Be kind to your sister.
Yeah, I said, be kind.
What were the first symptoms that you noticed? Like, how do you first notice, like, oh, I think I'm entering menopause?
Well, the first time I thought, oh, I'm starting, was with the hot flashes. Just because that was the only symptom I knew of, really. I was not aware of all the other ones. I think even my problems with my teeth, that they got so much worse, but I didn't know it was related to menopause.
How have your symptoms affected your day-to-day life when it comes to menopause?
The worst one was the insomnia. It was so hard for me to get sleep that just did a domino effect on the rest of my day. So the first doctor I went to, an endocrinologist, which they specialize in your hormones. He was a male doctor, and he said it was all in my head, which was not fun. So I went to another doctor, and she gave me, something for sleeping. And so now I sleep so good. The other symptom that has really affected me and that is still like a touchy subject for me is the weight gain. Because I didn't change anything on how I ate. I exercise every day, and I started just gaining weight. And I had worked so hard on keeping my weight at a healthy level, and I was so proud of myself for that. I know it sounds shallow, but it's the truth. It's been hard for me to deal with that one. You're getting gray hairs, you're getting crow's feet, which are things that have never bothered me. I think it's really good to grow old gracefully.
Right.
But then you mean I'm also gonna gain weight? That's not fair.
It's not fair.
And so I think those two
have impacted your day-to-day life.
Have affected my daily life the most.
It's interesting how you talk about finding that female doctor, because that's somebody that understands your symptoms and understands what you're going through. And yes. I'm sure that people might feel the same way about finding a female dentist, right? When it comes to somebody that's going to identify the symptoms and know how to work with that a little bit closer. Just
as you can't treat a non-pregnant woman the same you would a pregnant woman because of all the changes going on in her body, the same thing goes for a non-menopausal and a menopausal woman.
Right.
Do you notice any changes with me?
Not really, but I wish that I would pay more closer attention. I do know you've struggled with sleep before. I do know you've struggled with your teeth before. It's been something that you've brought to me before. You're not a very insecure person, but you have mentioned those things as insecurities, and you've tried to warn us, even your sons, not even necessarily your daughters, about the importance of taking care of our teeth from a younger age and going through that.
I'm glad you guys aren't like, oh my gosh, what's wrong with my mom?
Do you feel like menopause has affected your relationships in any way?
Just in that little thing, like it does affect your libido. Don't be embarrassed of your mom telling you about her libido. It affects it a lot.
Wow.
And I've been married for 30 years, and intimacy has been such an important part of my marriage. I can't take hormone replacement because I've had issues with lumps on my breast that they've had to remove. We worked together in finding help, And we have really good communication. So I was able to say, like, stay away, like, just for a bit while I take care of this.
Right.
And he was really patient, because are we going to be, like, really open?
I don't know how.
You don't know how open. Okay.
I don't know how open you're trying to be.
Things changed. And so it was really, that was when I said, no, I need to find something, because hopefully I'll be married for another 30 years.
Of
and
course.
I want it to be just as fun, and I want it to be just as beautiful as it's always been. So I was able to get good help, and I think my relationships have changed, but they've gotten stronger because I've been able to see what a beautiful support system I have surrounding me.
That's good.
In this area.
That's good.
Yeah.
You've always been a very calm and collected person. Did you feel, when you started feeling all of this, the wave of menopause hitting you, do you feel an extra sense of pressure of, oh, now I have to still maintain this calm, quiet persona that I am, even if it's harder than it usually is?
1,000,000% yes, but not coming from anybody else. It is something that I put on myself.
Right.
Because I like my calm and collected self. I mean, I don't go off on things, and I don't want that to start.
Right. Well, even if you do such a good job of keeping it in control, what is something that you would like others to consider about your menopause, about the effects that you might be experiencing through menopause?
There's women that really go through it like a breeze.
Yeah.
One of my sisters is like that.
Mm-hmm. Then there's others that probably...
And then there's others that will be much worse than me.
Yeah. You want to set the expectations for people to be like, hey, it's not always going to be the same set of symptoms, of rules. And you have to... The more we are aware of that, we're going to be able to deal with that and learn how to help in any way.
And not everybody is going to be able to get the same kind of help.
Right.
Because I have friends that can take hormone replacement therapy, and so for them the solution was easy.
Yeah.
But then for me it's been more complicated because of that limitation.
Mm-hmm.
Now, do you think this conversation has shifted your perspective on menopause at all?
I mean, I feel more educated, just in the sense of, I think that even, you mentioned that even women struggle to learn the totality of the fullness of how menopause may affect them. I could barely even define menopause at the start of this conversation. And there's no excuse for us to not try to learn about these things. In 15 seconds with your phone, you can find out exactly what you need to find out to be a better son, sibling, husband, etc., friend. And that's a responsibility we have to take on.
That's great.
Do you think Dad is going to take anything from this conversation once
when he watches it?
Yeah.
Yes, of course. One of the things I really love about your dad is he loves to learn.
Mm-hmm.
I think even me going back and listening to it again, I'm going to go like, yeah, I had forgotten about that one. So yeah.
That's good. Take notes, Dad. What about, you've already taught me plenty in this conversation, but what advice would you give me as a husband for my wife when she eventually reaches that point of her cycle?
My advice is not going to be for when she reaches that point. It's going to be to start getting educated now. Had I known that I could start in my 20s to prepare for this stage, like, really, I promise, I thought it was just hot flashes. Had I known I can start doing strength training, I can do, certain supplements can help, etc., that will minimize the symptoms, because you can't prevent menopause.
Right, of course not.
Every woman in the world is going to go through it. 51% of the population is going to go through menopause.
Right.
So it's not something you can stop, but you can make it easier.
I'm curious about the symptoms you mentioned regarding your mouth. If you could have gone back to your 20s, how would you have prepared for the symptoms that you experienced regarding your teeth and your mouth and your menopause?
go to the dentist. I had a terrible phobia of the dentist.
Right.
It was literally trauma because I have really high pain threshold. Is that how you say it?
Yeah, high pain threshold. It's hard for you to experience pain.
Yes. I mean, women give birth. I gave birth.
Kudos.
C-section without any pain meds. Can you believe that? It was very beautiful. But it hurt, but it was,
sure it did.
I have a high pain threshold. But the dentist, oh my gosh, I don't know. I was so scared of going to the dentist that I completely ignored my teeth for the longest time.
Oh, wow.
Until they started feeling weak.
Oh, wow.
And so I was kind of a little late in the game.
Yeah, it must be much harder to deal with the brunt of those symptoms right as it's occurring.
Your youngest sister, I recently had to take her to the dentist and she didn't want to go. And I did sit her down and say, hey, this is what's happening now. And it happened because I didn't want to go to the dentist because I was scared. Mm-hmm. So it's better to go scared and then not have to go through, like, the first appointment when I went to my dentist, the one that takes care of my gums.
Right.
He said, I think the best solution for you is that we take out all your teeth and do the whole implants.
Oh, wow.
I went home and I cried.
Yeah.
And thank goodness my other dentist was there and she said, hey, wait, let's take a step back. Let's do some research. And they both agreed they were going to do some research, study my case, and then came back. And thank goodness that was not necessary. But that was the first reaction.
Yeah, there must be other women that get to that point.
Yeah.
And it's like, hey, goodbye teeth.
And so I told your sister, I said, start taking care of them now so you don't get to this point.
Wow. That I'm going to be able to go home to my wife now and be like, hey, let's go to the dentist.
Yes.
Let's both go to the dentist. So what advice would you give to women that are struggling to talk about these menopause symptoms to their healthcare providers?
Don't struggle. Do it even if you struggle.
It'll be much more of a struggle afterwards if you don't do it rather than if you do it.
Yes, of course. There are so many tools you have today. You can send a text or you can send an email if you feel uncomfortable saying it in person. But really, there's no need for you to feel uncomfortable because it's a part of life. We need to start working at making it natural and just know that we're working together to make it better, to make your quality of life much better during this stage.
Mm-hmm. You learned, and that's how you were able to go with my little sister and say, hey, you need to do this for this reason. And it's because you put yourself through that situation of going, I need to talk to my dentist. I need to talk to my healthcare provider.
And I was, again, very shocked by how ill-prepared I was for menopause. Mm-hmm. And in school, they teach us about getting our period. They teach us about how you get pregnant. They teach us about pregnancy and childbirth, and nobody teaches us about menopause. Mm-hmm. And I think it's time we change that.
Yeah. All right. Well, I'm very glad to have had this conversation with you. I learned a lot. I'm going to put it to use.
I know you are.
And I think more people need to learn about this.
Yes.
So it's good that we had this conversation.
Thank you so much, baby. I love you so much.
I love you too. Thank you so much.
Thank you, everybody watching.
Thank you for watching, guys.
And go to your dentist, go to your doctor, and don't be scared of talking about menopause.
Talk to your healthcare providers and talk to the people around you.